IVF stands for in vitro fertilization. What is in vitro fertilization? When instead of the human body, the egg and the sperm are united in a glass dish or in a glass pipette, then that's known as in vitro fertilization. In layman's language, it is also known as a test tube baby. See, fundamentally, we are designed to have children. Most couples have their pregnancies within 1 year of trying time. Some of us do not get pregnant within 1 year. Then we end up seeing a fertility doctor. Tests are carried out and a problem may be identified either in the sperm or in the egg or in the womb or maybe in the fallopian tubes. The fallopian tube is the site of fertilization in the human body. Eggs come via the tubes into the tube and the sperms come via the vagina uterus into the tube, and both of them unite to form the fertilized embryo. Now for some reason, if the tubes are blocked, then the eggs and the sperms cannot unite and a pregnancy cannot happen. This is the primary reason why IVF was invented, and this is what the fundamental indication for an IVF is all about. So IVF can help create embryos by fertilizing the egg and the sperm in the dish, because in some cases the fertilization is not happening because of a blocked or a damaged tube. What are the steps of an IVF cycle? You select your patients properly. These are couples who you think will benefit from the process of IVF. Then you explain the process to them. So that's the counseling. You'll have to tell them the steps. You have to tell them the problems, the side effects and the complications. You'll also have to tell them how to prepare themselves for the IVF cycle, and we also have to need to tell them what are their probable success rates. Post-counseling, the lady is usually started on her injections. Why do we give injections? Because one egg grows naturally every cycle, and we are not as smart as nature and we cannot work with one egg. We want as many eggs as possible. So we give injections to the female partner to help her grow more than one egg. Today is injections, maybe subsequently tablets may be invented, and that could also do the work of injections. These injections usually need to be taken for 8 to 12 days. Please make sure that you are injecting yourself in the proper technique and at the right time. Do not make mistakes, because these injections are going to make your eggs grow up. Why do we need to give these injections? Because we are not as smart as nature. We cannot work with one follicle that nature grows every month. We want as many eggs as possible to increase the probability of pregnancies. Once these injections have been started, you'll be called for regular ultrasounds. Why do we do these ultrasounds? To monitor the growth of the follicles. Usually the doctor would not change the dose. Sometimes the dose may be increased or decreased depending on the kind of response that you're showing. That doesn't make any difference to your overall outcomes. Once the follicles are ready, which we get to know with the ultrasound, then we advise that you have to go for a ovum pickup. That is, these follicles have to be aspirated. This is usually carried out under anesthesia. The anesthesia that is administered is a total intravenous anesthesia, does not have any after effects, and you are good to go home within 1 to 2 hours of ovum pickup. You do not have any pain as well after the procedure. Once these eggs have been extracted, the very same day the male partner is also advised to collect his semen. Usually a semen sample would have been frozen some time back as well as a backup. Why do we do that? Because many times the men find it difficult to give a semen sample when their wives are in the OT. Once we have the semen sample that has been processed and the eggs that have been collected, they are fused together in the lab. Either they are kept together in the dish, that's known as an IVF, or the eggs are injected with the sperms, and that is known as ICSI. Then the formed embryos are monitored in the lab every day till they grow to what is known as a blastocyst. That's a 5-day embryo. We wait for the blastocysts to form. We do not freeze them earlier because we actually want to get you pregnant with those embryos. And most of the eggs are not healthy. So the only way we can find out whether these are good looking eggs or bad looking eggs is to allow them to grow. The bad ones would usually stop growing. The good ones will keep growing. and till day 5 there would be some sort of a differentiation created between the good ones and the bad ones. Ideally, in the best case scenario, we would have grown them further. But the lab is not equipped to grow them further because these embryos are now live beings and they require a lot of nourishment which cannot be provided with modern day supporting media. Once these embryos have been created, they are usually frozen to be used in the subsequent cycle for embryo transfer. So then what are the steps of an IVF cycle then? We select our couples, we counsel them thoroughly, we put them on medications, we go in and pick up the egg, we make embryos and then we freeze them to be transferred back to her womb through the next transfer cycle, which is known as the frozen embryo transfer cycle. We usually do frozen embryo transfers because we feel that is more physiological and the body accepts it better. But in some circumstances, we also do a fresh transfer, in which case the lady is called back on the 6th day of ovum pickup and the embryos which have now formed into blastocysts are selected and put back to her womb, either 1 or 2 at a time, not more than that. When we do the frozen embryo transfer or the fresh embryo transfer, then to maintain the pregnancy in the first 3 months, you are put on certain medications. Again, these are very, very important medications. They have to be taken at the right time if you don't want to mess up with your cycle. Hope this was helpful.